Okay gents, welcome to the first educational blog post that's going to be part of a series as mentioned in 3.0 launch. The topic for today's discussion is what is neutral posture and why is it important in everyday life. So to be discussed, we're going to look at the anatomy of the spine. This will just give us a little bit of a background as to sort of the vertebrae that are there and just some of the roles and what these vertebrae are there for. We're also going to explain what hips tucked under, core tight and a neutral spine actually means. You've heard us talk about it in camp, now we're going to make sure that this is all nice and clear. We're going to look at some of the contraindications of poor posture. We're going to look at how this relates to Spartan training, and then also, just so that you guys are aware, just some of the potential injuries that can come about as a result of bad lifting technique. So to start us off, in front of you is a picture of our spine and all the vertebrae that are linked within this. The spine is made up of 33 vertebrae and they're categorised into 5 sections which are shown in the diagram. Now your cervicular spine, this is the part that particularly is in your neck, so located in your neck rather. There are 7 vertebrae here from the base of your skull just down to the base of your neck. You'll hear us saying keep your neck neutral a lot of the time. This is particularly that area that we're looking at. You've then got your thoracic spine. There are 12 vertebrae here, and this is all to do with rotation as well. You then move further down, you've got your lumbar spine. Now this is the main weight-bearing aspect. As a result, as you'll notice from the diagram, there's some of the largest and some of the strongest vertebrae found in your spine. This is to cope with a load. Predominantly, if there's going to be an injury such as a disc damage, then it occurs in this area. To finish, right at the bottom, so moving further down towards your coccyx, you've got your sacrum and your coccyx. These two are fused and it also makes up part of your pelvis. This is where it attaches. So we talk a lot about hips tucked under, core tight, and I just want to go through what this actually means. So as you can see, the diagram, which is taken from the Best Desk-Bound book by Dr. Kelly Starrett, this is neutral posture, and everything here is being explained as to what actually factors into a neutral posture. Now the 2 areas that you can see highlighted are the abs and the glutes. Now when these are contracted and you, as we say, tuck your hips under and you keep your core tight, as you can see you've got a very nice neutral posture. As soon as you relax these muscles off, this is where potentially our posture can start to have an issue, especially when training. So we need to make sure now you guys can understand what hips under and core tight actually means. So here we have some of the postural conditions. I just want to note very quickly that some of these can be hereditary conditions, but also some of these can be brought about due to muscular imbalances and also just general hypertonicity in muscles, so that tightness through the muscles. There's some examples, as you see from the far left and the middle, of normal posture and what this looks like. But as you can also see, and we're going to go on to in some detail, you've got examples of kyphosis, which is a curve in the thoracic spine, lordosis, which is an excessive curvature in the lumbar spine, and then scoliosis, which is a lateral curvature. So on to hyperkyphosis. Now anything with hyper in the name means excessive, so it's very nice and easy sort of terminology. Hyperkyphosis therefore is excessive curvature, a kyphotic curve of that thoracic spine. Now this can be brought on by long-term tightness of your pectoral muscles, which are your chest. This is also known as upper cross syndrome. In this, as you can see from the diagram, there's a very excessive curvature through the thoracic spine. The shoulders have started coming forward slightly, and you'll also notice that the head angle has moved forwards also. So to explain upper cross syndrome in a little bit more detail, the easy way to explain this predominantly is you have 2 muscles or 2 areas of musculature that become really tight. They become really short and over tight. As a result of this, however, the other muscles become weak and they become long. So that's why, as you can see from the diagram, when we say a cross syndrome, it's because on one axis you've got tight muscles and the others therefore become long and weak. So for upper cross syndrome, as we've already mentioned, this is tightness of the muscles in the pectorals, which is your chest, and your upper traps and levator, so this is at the back of your neck. These become tight and short. As a result of this, your cervical flexors, which are your anterior neck muscles, and your rhomboids and lower traps, so these are muscles in the middle of your back, these become overstretched. So instead of being short and tight, they become long and weak. You therefore lose integrity, you lose strength in your posture, and this is what results in your head coming forward slightly, so actually leaning forwards. It results in your shoulders rounding off and just leading to that hyperkyphotic curve. If we relate this to training, then you're going to lose range of motion. You will also end up with a weakness in this area, so when you try and push your weights, you're not going to have as much drive behind you, so this can affect our training in quite a drastic way. So again, we talk a lot about the importance of keeping your head up in training. Now there's 3 examples in front of you that I want to discuss. On the far left hand side, with the neutral posture, as you can see, the effect of gravity on your head weighs in at roughly about 10 pounds. This is about 4.5 kilos. Now for every inch that your head moves forwards, this effectively adds 10 pounds. So 2 inches forwards, the effect of the gravity weighing down upon it would equate to an extra 9 kilos. That's over a stone. So again, I'm just bringing these in so you can start to appreciate the importance of neutral posture. On the far right picture, 3 inches forwards, this means your head weighs in at an astounding 18 kilos. Effectively, if you want to relate that to training, imagine hanging a 15 kilo dumbbell from your head. That's the amount of pressure that is going through your neck. So it's really important, again guys, just trying to make you aware of how important this neutral posture is, but also the impact that it can have long term. As you can imagine, if you've got that excessive movement in your neck with your head forwards, imagine that force coming down through your neck, then it's not going to have good results long term. So we need to make sure at all times we are aware of having good posture. Okay, so moving on. So we've already discussed that hyperkyphosis was excessive curvature of the thoracic spine, so middle of the back. So the other, which is lower cross syndrome, is hyperlordosis. This is excessive curvature of the lumbar region. Now, as you can imagine, when we squat, when we deadlift, we've already discussed earlier, looking at the anatomy, that the lumbar region takes a lot of the stress, a lot of the strain, and this is our main weight-bearing aspect. Now, if you've got a hyperlordotic curve, where you've suddenly got this exaggerated excessive curvature through your lumbar area, it's not going to be able to cope as well with the amount of pressure that you should be able to put through these particular vertebrae. Again, this can be brought on by long-term tightness, predominantly in hip flexors, which, as I said, causes lower cross syndrome. This can also cause a forward hip tilt. This overarches the lumbar spine, so this can be hereditary again, just with the lumbar spine, but it can also be brought on by tight muscles. Looking at the muscular side of things, so lower cross syndrome, very similar to the upper, as you can see from the diagram with the cross. There's 2 areas of tightness and 2 areas of weakness. So for lower cross syndrome, the tightness of the muscles in the hip flexors and your thoracolumbar extensors become tight. As a result of this, not only do they become tight, but they become shorter, so the range of motion is affected. This then leads to the abs and the glutes becoming overstretched and weakened, so very similar to the upper cross syndrome. You've got 2 areas that are short and very tight. You then have 2 areas that are overstretched, they're long, and they become weak. To relate this back to our training again, range of motion will be affected. You'll have a weakness in this area, and it's going to take a lot of work to try and restore this posture back. So again guys, please don't start self-diagnosing. This again is just to make you more aware of neutral posture and how important it is when we train in camp that you make sure you're aware of these aspects at all time. Okay, so to relate this now to our training, so here in front of you is an example of a neutral spine when training. In particular, I've chosen the deadlift because this is an exercise that we've highlighted quite a lot. We pride ourselves, so we really focus on form in particular. On the left hand side, as you can see, some of you may think this is relevant to your form as well. So again, this isn't designed to scare, this is just designed to educate, just to get you guys thinking more about your technique when training. As you can see, as discussed previously as well, there's a hyperkyphotic curve. So in the middle of my back, that thoracic area is very, very extended. So it's an excessive curvature of that kyphotic area. On the far right hand side, you might be thinking, well, the back's flat, that's pretty good. Actually, that's not too bad a technique. But what you will also notice is that my head positioning, so we've just touched on this already, my head is in a severe extended position, okay? So although the back might look straight, there's a lot of potential damage going on through the neck. In the middle then, so the neutral spine, my neck is neutral, my back is nice and flat, there's no excessive curvature, really good posture, and this will maximise in training in particular not only injury prevention but also the maximum effect to your training. So you will find that you'll have a maximum power output with this correct posture. To relate this again to another exercise, the ropes. Now this again may be something you might be thinking, well actually how hard can ropes be? Can you get this wrong? And as you can see in front from the examples, it is actually possible. So again, on the far left hand side, now this is a very common posture position to get into when you're fatigued, when you're tired. So this is where you sort of get really tired, you lean forwards, you aren't aware of what your back's doing, you suddenly end up with this hyperkyphotic curve. Considering that you're exercising your chest and your arm muscles as well in particular, these are only going to tighten up, and this is going to just exacerbate that curvature by tightening up your chest and your arms. So we must be aware of this postural position when on ropes. On the far right hand side, again as you can see, there's a slight curvature in my lower back, so that hyperlordotic curve. This is where the lumbar region is extended, my bum's actually too far back, and as you can see there's too much of a curvature in that lower back. In the middle, nice neutral spine, nice neutral neck, and again there's no excessive curvature, so that perfect position. Again, with this position now you can maximise the amount of power you can put through the rope, so it maximises our training as well as prevents injury. Now, as I've touched earlier on, guys, I want to make sure that you don't start self-diagnosing. This is more just to educate. So I want to make you guys fully aware of not only some of the indications of what is a good posture, but what can come about as a result of poor posture as well. So this is something that we must be aware of when we are training camp, because this is what we're trying to avoid. So just a couple of injuries. So the main one that we're at risk of, particularly exercise like deadlift, is a disc herniation or prolapse disc. Now, to use the donut analogy, if you imagine that you're holding onto one side of the donut and you squeeze, and the pressure causes the jam to squeeze out the other end, this is effectively what can happen with your discs. Now, your discs are there and designed in between your vertebrae, particularly in the lumbar areas. You can see they're slightly larger to take that extra strain. They are there as a shock absorber. If you have part of the inside of that disc that's squeezed out the back, as you can see from the red arrow, it's pointing it out, then this can possibly compress on the nerve. So not only will it not be able to do its job and absorb the shock from your lumbar, taking all the pressure that it's designed to take, it will also be impacting upon the nerves in your back, which can transfer down your leg. This can be very painful, guys. So again, if you keep that neutral posture when we train, we negate this risk, and therefore we train, we keep our posture good, and we prevent injury. Just to quickly go through some of the symptoms of this again. So if you're in training, you're aware that maybe you were tired, your posture suffered a little bit. If you suddenly have a little bit of an ache, again, this is more designed just to make you guys aware, and so you're better educated. We will ask that you stop training. We can't recommend highly enough that you stop. We don't want you guys to train through the pain, okay? But just quickly, so some of the symptoms. Sometimes an inability to stand up straight. So where that disc has damaged or shot out backwards, you will find there is a position that is more comfortable because it alleviates the pressure off that damaged area. Predominantly this is leaning forwards. If you lean backwards, if the disc damage has shot backwards, that's where it's going to compress it and it's going to hurt. You can also get sort of shooting pain or a numbness, as I've mentioned, that can travel down your leg. This is where the nerves are being compressed by the herniation, so that's another factor to consider. Also, with severe localized pain, you'll probably be able to pinpoint it to the middle of your back. You'll actually be able to feel it, but the pain will also radiate all the way across your lower back. So just 3 easy symptoms in training for you to be aware of. If you feel any of these, then stop immediately, guys, okay? Please do not risk injury. Okay, so the conclusion, some points to take away. So in particular, guys, keeping your glutes and your abs tight, so the hips tucked under, core tight. If you manage to do this position whilst training, keep your head in neutral position, you'll help with your posture, you keep your spine straight. This will lead to much, much better training and actually a lower risk of injury, as you've seen from above. Just touched upon, so this will prevent injuries such as disc damage, also some of the muscular imbalances. So we're trying to maximise all times our training output. We're trying to do this with the best posture we can. If we have good posture, then we manage to avoid injuries or imbalances for the muscles such as the upper or lower cross syndromes. We'll also maximise our training, enabling you to train harder, lift more and stay injury free. Fantastic. Thanks very much for listening, guys. I hope this has been useful. Again, it's designed to educate, not to scare. Any questions, please drop me a message. Thanks for listening.